Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
On the 11th of January 2023, Uganda will be declared Ebola-free if there are no new infections. The country, according to Health Minister Dr. Ruth Aceng, has been dealing with several disease outbreaks including malaria, potential monkeypox outbreak, HIV/AIDS, COVID-19, and more recently, Ebola. The Ebola outbreak was reported 6 weeks late, which resulted into 142 confirmed cases, 87 recoveries, and 56 deaths from 7 districts. The Director for Health and Social Services at the Uganda Red Cross, Dr. Josephine Okwera, says the best way to deal with disaster is to be aware, especially for disease outbreaks.
And then they know how to manage when that threat comes. But even before we get to that point of managing, they know how to prevent. For example, if it is epidemics, disease outbreaks that we are talking about, to be prepared means the community has the right information about the likely disease outbreaks. They know the signs and the symptoms, and so they know how to prevent those common diseases that could become potentially an outbreak. And then when there is an outbreak, they can quickly detect.
But to do this at household level, the community needs to have a heightened level of suspicion and thus be able to report.
So reporting is very critical, because if they know and they can identify but they don't know how to report, then it means the response is not going to reach to them quite quickly. So reporting and the lines and means of reporting should be in place for us also to say that we are prepared. And then, of course, to the people to whom the report gets, they have on their plate what to do as well. And this, in most cases, is our health facilities. When they get that information, are they also prepared to handle the cases, or even to investigate the alerts they've gotten from the community?
Dr. Okwera says whereas there is some level of awareness, the public's risk perception is still low, which could be disastrous.
We did experience it in Mubende, the recent outbreak of Ebola, where people had been dying in that community for almost a month before the first case was confirmed. So meaning people saw strange deaths, strange symptoms, but nobody was reporting.
She recommends the formation of village task force teams that will take charge of surveillance.
At Red Cross, we are supporting some communities to establish that system that will be toll-free, but also SMS-based, so that if you see something strange in your community, you can send an alert. And this alert is evaluated by the district surveillance officer. And then they can come to check to verify if it's a true alert that needs the health workers to respond, or if it's not a true alert, they can still give advice that is appropriate to contain whatever condition it is.
However, the Health Minister, Dr. Ruth Aceng, says the plans sound good on paper but are extremely expensive to implement.
The community health extension workers that we are talking about are trained for 6 months on all aspects of diseases. The community engagement we are talking about is sensitizing the communities on all aspects of diseases. That is what we mean by health promotion and disease prevention. Now, when we talk about that, that is not a cheap thing to do. Actually, to run a full sensitization of the communities may require more funds than we put in clinical treatment. And so it has to be done through the community health extension workers and through media houses, newspaper prints, the radios that we have, and so on and so forth. All we need to do is to ensure that every district health officer is prepared to run this program.
Dr. Aceng says once it is done, the disease burden would be reduced by at least 75%.
I can't tell you how much we need currently because we are still working out all this in terms of costing.
The government has never fulfilled the Abuja Declaration to locally finance the health sector by 15% of the national budget, which many experts think continues to stifle any proposed plans to improve the sector. Walter Mwesigye, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.